Welcome to News West 9's West Texas View with Johnny Lou Avery.
Welcome to the West Texas View. I'm Johnny Lou Avery, and our guest again today is Dr. Ted L. Mitchell. He's the new president of the Texas Tech University's Health Science Center that has facilities in the Permian Basin, El Paso, Amarillo, Abilene, all over the place. And they're doing everything they can to make medical care accessible and also to make it cutting edge accessible to everybody in this very spread out part of our state. And so we've been talking, the first program that we did last Sunday, we talked about his family and his credentials and his own personal vision after having done a lot of 20 years of work at the Cooper Clinic. But today we're going to be talking about specifically the programs and the locations that we have those programs, and then get into his view of what he sees is happening in the Permian Basin area. So welcome again, Dr. Mitchell. It's such a pleasure to have you. And I want you to get right into it and talk about the specific programs and the locations and so on.
Super. Well, you know, last week we talked a little bit in general about the responsibility that we have for West Texas, the Texas Tech Health Sciences Center. And it's important for folks to understand that when we're trying to well, it's important for them to understand this. There are three things that academic medical centers are charged to do. Number one, educate healthcare providers. Number two, provide service to the patients. And number three, do it in a way that's researchable so that we can add to the body of knowledge in medicine about what it is that we're doing. Share it with others, other healthcare providers and the like. And when the system was first formed 40 years ago, of those three missions, education, patient care, and research, it was really the education was the big thing. We had a severe shortage, which we still do, but we had a severe shortage of physicians in West Texas. So they said, listen, you guys at Texas Tech, you just make some docs, just get some physicians out there for West Texas, and in particular, primary care physicians. Well, as things have evolved over time, the needs have changed, and so our focus on the mission changes with it. It grows with it. So we absolutely still have to provide education for healthcare providers, but not just physicians. Nurses, pharmacists, allied health personnel, physician's assistants, physical therapists. The spectrum really opens up for who we're providing education for. As far as patient care, as we discussed last week, the things that were stated objectives 40 years ago have also changed because we have this large area of landmass that is sparsely populated. We've got to be innovative about the way we get care to those people. And then the third part of it, the research part of it, that's something that we need to be able to say, listen, we've got some innovative ways of doing things, but we need to make sure that what we're doing is an appropriate way to do that is cost effective and provides the care that we need to provide. So the mission's really changed. Now, over the past 40 years, the system has really grown. Instead of having primarily just a school of medicine in Lubbock, we've got campuses all over West Texas. So we've got campuses in Dallas and in Abilene and in Amarillo and in Lubbock. Permian Basin here, both in Midland and Odessa. In far West Texas, we have the campus at El Paso, and we even have a small campus in Marble Falls down near Austin. So we really do cover the area significantly. And it's important for people to understand that it's not just working with the various communities in those campuses, but in each of those campuses, we have different components of the university. So we have School of Medicine, School of Nursing, School of Allied Health Sciences, School of Pharmacy, and they're represented in various ways on those various campuses. So it's really two things happening. It's our involvement in the community in general, and then it's our involvement in the community specifically with the particular schools that are there.
And but the thing that's confusing me and probably a lot of listeners is when you said Dallas and Marble Falls, that's out of the West Texas area.
It is, and I will tell you that when it comes to growth of academic centers, oftentimes things will grow because if someone says, look, you know, we would like you guys to move into an area over here in Austin, We want you to move into an area over here because we've got a need here that we would like Texas Tech to come and help fill for us. Then we go ahead and do that. Our primary initiative and our primary drive, though, for general health is for the West Texas area.
And those centers in Dallas may be training rural health doctors.
Well, the center in Dallas that we have is purely for pharmacy.
Oh, okay.
Okay, so they work actually quite closely with the University of Texas Southwestern Medical School.
Oh, okay.
So our pharmacy students are working closely with the medical students and the nursing students at the University of Texas Southwestern.
Okay.
And they're helping to work with them in an interdisciplinary fashion.
Okay.
And we produce, I must say, just absolutely phenomenal pharmacists for the entire state, for the entire region. New Mexico, Oklahoma, they love getting Texas Tech pharmacy students.
And another thing that's changed is you're seeing some older students come back to school,
Absolutely.
changing careers.
Well, and let me tell you something. You know, folks that have a bit of life experience, they bring something completely different to the table. For one thing, they tend to be more mature. You know, they've been there, done that. And I'm saying this as somebody that I went to medical school. I finished college in 3 years instead of 4, and so I was the youngest guy in my medical school class, and I was just in a hurry to get through school. But the fact of the matter is, in retrospect, you look and say, well, I was not as mature. My father, who was a physician, had gone out and worked as a driller in the oil fields for about 10 years before he ever went to college. He was a much better, in my estimation, a much better student. I don't mean smarter, but a better student, more disciplined about life.
Yeah.
Exactly. So that is something that you are seeing, people that have been out doing something else that have decided to come back into one of the health-related fields, and they tend to be just phenomenal students.
Well, I've seen this more and more with nurses who started out in a career field. Maybe they already have their degree.
Sure.
And then they say, what I really want to do is to be a nurse. And men or women. And so then they'll come back and say, oh, I'm 30, am I too old? And,
well, they make some of our best students.
And of course, at nursing school, everybody says, no, you're not too old. No, you're not too old. And so that's been a really interesting phenomenon as I've watched it.
Sure, and we need the help. You know, as much as we're down on physicians for the area, we're also significantly down on nurses.
Well, and as these chronic conditions are exploding around us because of our bad lifestyles, then it just requires more and more. It's not so much that we've never had enough, is that we just can't keep up with the demand. And so that makes a huge difference. And so, but anyway, as I said, we've spread out. When we first started, we had Odessa and Amarillo and Lubbock, and then we added El Paso, and we just keep growing and growing, and it's just been a source of pride for me. But I want us to talk specifically about the university presence in Odessa and Midland and how that specifically serves this area when we come back after a break. We'll be back in just a minute and continue this conversation with Dr. Mitchell.
Stay tuned. West Texas View will be right back.